Good morning, and thank you to Mr. Gagliotti and to the Department of Justice for inviting me to join here today. Combating fraud, waste, and abuse in Medicare, Medicaid, and other HHS programs is our mission at the Office of Inspector General. I am proud to be here today representing the tremendous work of our criminal investigations team in this takedown. This unprecedented healthcare fraud takedown is more than twice as large as any past one, having stopped national and global fraud schemes alleged to have resulted in over $14 billion in intended losses. The results announced today were only possible, though, through a strong partnership of federal and state agencies. By working shoulder to shoulder, we harness the best information, tools, and expertise to find criminals, no matter where they hide, and no matter how they try to disguise their crimes. I would especially like to thank DOJ, CMS, FBI, DEA, and our other federal partners that are here today. I would also like to acknowledge the state Medicaid fraud control units, as well as the strong public-private partnership between government and private insurers to combat health fraud. Simply put, criminals go where the money is. Through information sharing, government and the private sector help each other to more efficiently stop fraud. And under our watch, criminals will not be allowed to enrich themselves with dollars meant to improve the health of Americans. One massive fraud scheme that was charged as a part of today's takedown involved multiple durable medical equipment companies that billed Medicare over $10 billion for equipment that patients did not need or that they never received. The good news for the American people is that the alleged criminals in this scheme never got their hands on most of that Medicare and Medicaid money that they tried to steal. Instead, the government coordinated to use our collective tools and authorities to protect taxpayer dollars. This takedown also demonstrates, though, our commitment to shield Americans from harm. The actions taken by our partnership stopped individuals and entities that were alleged to have used stolen medical identities from over 1 million patients to submit false claims. They preyed on patients who needed addiction services, billing for treatment that was never received. They illegally diverted prescription opioids, millions of pills that continue to fuel the devastating opioid epidemic. But as fraud schemes span borders and jurisdictions, OIG and our partners respond quickly and effectively. And as fraud schemes increasingly exploit technology, we use cutting-edge investigative methods to detect fraud, prevent losses, and protect patients. Before I close today, I must take a moment to applaud the exceptional work of the dedicated OIG professionals that participated in this takedown. Every day, these outstanding law enforcement professionals do the dangerous work of holding criminals accountable. Thank you for your service to the American people.